Good afternoon, everybody. Thank you for being here today. I'm Representative Kelly Fenton, and I represent House District 53B, which is in Woodbury. And we're here to talk to you today about legislation being introduced in both the House and the Senate that will aim to help enhance our workforce participation and lift Minnesotans out of poverty. The concept behind our legislation is simple. If you are a healthy, able-bodied adult on medical assistance who is not at home caring for a child, that you should either be working, looking for work, or participating in one of Minnesota's countless job training programs. So our economy is growing and wages have been rising, but so too has enrollment on this public program benefit. And this is a sign that there are too many Minnesotans who are still being left out and out of the economic recovery. As policymakers, we should be troubled by increased public program enrollment. Rather than growing the number of people on welfare, we should be growing the number of people who are able to move off welfare and into good paying jobs and participating in Minnesota's growing economy. So last week, for the first time in years, we learned that there are currently more job openings in Minnesota than job seekers. Many employers are telling us that too many job seekers lack the skills and training needed to fill openings. So under this legislation, participation in workforce development programs would fulfill the work requirements and help Minnesotans get the skills they need for the job openings that are available. This is a win for Minnesotans and a win for our workforce. And now I'd like to turn it over to Senator Mark Johnson.
Thank you, Representative Fenton. Good afternoon. I'm Senator Mark Johnson. This is really a wonderful proposal we have here. This is a common sense proposal, supports that Minnesotans really support. Minnesotans generally understand the need for medical assistance. We're known as Minnesota Nice. And this is because we're compassionate to those of us who are in less fortunate circumstances. But Minnesota Nice also comes with some responsibilities. Responsibilities such as able-bodied adults who aren't in school should be required to work part-time or look for work or do community service in order to qualify for these generous medical benefits paid for by their neighbors. We want to know that our tax dollars aren't being wasted or thrown away. With a booming economy and historically low unemployment rate, this is the right time to make the system fair and to make sure that everyone has skin in the game. I also want you to know that we're open to reasonable changes in this bill. Our goal is not to hack at medical assistance benefits, but to be prudent in its administration. With that, I'll turn it over to Senator Benson. Thank you.
Hi, Senator Michelle Benson, Chair of the Health Human Services Finance Policy Committee. As Chair of a Human Services Committee, I have a front row seat to the unsustainable growth in our public programs. As baby boomers age, Minnesota and other states are going to face a funding crisis. This bill is a prudent step for thoughtful use of taxpayer dollars while leaving resources available for those who cannot take care of themselves. This is the Minnesota way to encourage those who can to work and to make sure we can take care of those who need our assistance. I'd like to turn it over to Speaker Daudt.
Well, thank you, and I'm very proud to be here on such a common sense piece of legislation supporting an issue that I think would be so good for our state. We've seen such a large increase in the dollar amount that we spend on medical assistance over recent years, and as I've often said, since this Governor Dayton took office on his first day, we have more than tripled, or excuse me, almost tripled the number of people on medical assistance. And I have to believe that the number of people that need medical assistance hasn't necessarily tripled. We've got more jobs available than we have job seekers, and I think now is the opportunity. If we don't put reforms in place like this, those growing budget numbers are going to simply mean that we can't afford to take care of the people that really need these programs. And so I look at this as a very common sense and also compassionate piece of legislation. And I think what we want to do is protect these dollars for the people that need them the most. And I think that's a really important point. You know, frankly, in this piece of legislation, what could be more common sense than saying that people who are able-bodied, who are not sole caretakers of children, people who are able-bodied, need to either be looking for a job, have a job, or be participating in a job training program in order to be on public programs. We think that just makes common sense, and I think that's something we should all be able to agree on. So with that, I think we'll take some questions.
Minnesota already has one of the highest workforce participation rates in the country. How realistic is it to expect that that will grow much?
Thank you so much. And I want to reiterate that just last week, we learned that there are currently more job openings right here in Minnesota than job seekers. So giving these individuals the help and the job training to move into our workforce, to lift them out of poverty, I think is a great thing.
What about, I've heard from several groups already extremely concerned, some even calling this cruel, saying it's just going to result people being sicker with less coverage.
Well, we have really generous healthcare programs in Minnesota. We fully expanded medical assistance. We have Minnesota Care. As people continue to work, and as you know, when you work, you gain skills and you can be promoted in an economy with high workforce participation, more job openings than people available. This is a great opportunity for people to move rapidly through our public programs and into independence when it comes to their health care. We have no gaps in our healthcare system. MA, Minnesota Care, we're not touching anybody with a disability. We have exemptions for people who are medically fragile. And so I look at this as an opportunity for people to get on board with a growing economy and start fulfilling their highest potential.
Would those jobs be the kind of jobs that would have health insurance attached to it? Is that your expectation?
Well,
that they'd move
we
into those
see a
type of
gap
jobs?
in manufacturing jobs. Those are pretty good jobs. And the training doesn't take a 4-year degree to be well qualified for a manufacturing job. And so those generally do come with healthcare coverage, vacation time. So, but we need people getting into the workforce, learning those really important executive functions, being to work on time, following through on a job. And then once you're doing that, I think Minnesota is a great place for you to grow your career.
I want to just add to that, if I can. Remember, and that's why I think this is such a compassionate piece of legislation. Remember that having a job is one of the qualifiers to actually get this benefit. So if they are employed in a job that maybe doesn't offer them that level of benefit, they would qualify for medical assistance. It's folks that aren't looking for a job, don't have a job, and are able-bodied. Those are the ones that we're trying to encourage in to fill these jobs that now we know are available out there. And my guess is those people have not been looking for jobs. They haven't been in the, they're not being counted in the statistics and the unemployment rate and others. So this really is, I think, a compassionate solution. If they are in a job that does not provide those benefits, they would still qualify. And this could be a qualifier to actually get them on medical assistance if they need that. And I think that's the great part about it.
How many or what percentage of current medical assistance recipients are in the category that you're trying to reach here? Is it, do you have a number estimate or a percentage estimate?
Yeah. Right now, when we talk to the department, and it sounds like somewhere in the neighborhood of 125,000 potential individuals that might be affected by this individual piece of legislation.
So those are people who are able-bodied and getting this assistance, and they're just not working or even seeking work?
That's correct, yeah.
And that's out of about 1 million? That's the stat I have, that there are 1 million Medicaid recipients in Minnesota?
Do you want to speak to that?
There's about 400,000 that would be in this non-disabled category. And the department went through and filtered out for the exemptions that we have, the first screen exemptions, and came up with about 125,000 people that could potentially be seeking work, going through job training. There might be other factors in their life. If they're medically fragile, they would be exempted, but the number we're going to start with for planning purposes is about 125,000.
Are there 125,000 jobs that these people could qualify for?
Remember, they also don't need to get the job. They just have to either be training for it, looking for it, or have it. So it doesn't, they don't have to find a job to qualify. They don't, this really is a very compassionate piece of legislation that I think will reduce the number of people on medical assistance who don't really need it. And that is important to us because we want to preserve those medical assistance dollars for the people that really do need them. And as we see over the course of the past few years as budgets are skyrocketing, and particularly in our health and human services areas, this can be part of that solution.
How seriously do they have to be looking for work? Can they just be throwing in an application every week?
So I do want to stress that in this legislation, we do offer a lot of flexibility to the Commissioner of Human Services to help be a part of deciding what does this look like. But look, again, I'm going to stress that you can be in a job training program and you would qualify for your assistance, looking for a job, accepting a job. So there's a lot of flexibility, though, that we do leave with the Commissioner of Human Services to help be a part of designing what this looks like. But again, there are more people than, more jobs in Minnesota than there is workforce. And what a great opportunity to move people out of poverty into good job training skills, good jobs to help sustain themselves down the road. I think this is a very positive thing for Minnesotans. This is not meant to be punitive.
I think one of the requirements for the CMS waiver has to be budget neutral. So the administration of this is going to have to essentially come out of the cost of the program here. Aren't you just going to cut the amount of money available for health care for poor people?
We're doing our best to align this with the required SNAP and TANF work requirements already in place, already enacted by the counties. There will be some cost that we will have to pay for. There will be programming. There's been a lot of IT talk. This is going to involve some IT, and we're working on what that will look like. But we think in the long run, the investment in helping people get to work is going to be worth it for Minnesota.
What about the savings too? Can I follow up just on the dollar amount? What about the savings if 100,000 people leave the state rolls?
We hope those 100,000 people then become taxpayers and totally cancel out the cost of.
What do you know they cost the state right now? And what you
We have not seen the preliminary fiscal note. We had the first fiscal note meeting this morning.
Do you offer an exemption for people who are caring for young children? And is there an age threshold for the young children? Is there a family size adjustment? All of that.
If you are caring for someone who is a dependent, disabled, young, there is an exemption. Again, we're aligning with existing work requirements because our goal isn't to unduly burden county eligibility workers. Our goal is to get more people into already existing workforce programs.
So some states have required parents with children as young as 1 year old to work. Is there an age of child threshold here?
The original draft had school age, but we are considering if you have, once your children are 18, then you would be expected to go to work. And so we're working collaboratively with the House. We want to make sure we're in, that we're doing common sense things that the average Minnesotan would look at and say, yeah, that makes sense.
And Mary, I just want to add to this. In the House bill currently, it is if you are caring for a child at home, you are exempt from these work requirements. If you're caring for, if you're the sole caretaker for someone with a disability, you're exempt. So essentially, childless, able-bodied adults, if you're under the age of 18, you're exempt. If you're over the age of 60, you're exempt.
Do you plan to provide any additional funding or resources for the counties that do workforce services?
think that's a very good question that we got to address with the counties right now. Right now, we're not sure how we're going to implement this within the counties per se, but it's goes along the line of TANF and SNAP. So there's already kind of a process involved, but it'll take some costs there, and we're trying to figure out what the best way of doing that. Like I said earlier, we're open to reasonable changes. That might be something we're looking at, but we don't want to put an extra burden on our counties. We know how our counties are already strapped, but we think that this will be a program that we can adjust to fit the needs of our counties. Thank you.
Do you want to fold this in, probably Senator Benson, Chair, do you want to fold this into an omnibus bill or let it ride alone separately and potentially be veto bait for the governor?
We're going to wait for the governor's supplemental to come out, and then the House and Senate are going to decide on a budget strategy. So I'm going to refrain from commenting on a path for this bill until we have a little more global view.
Mr. Speaker?
I'll just add on to that, too. I think your question had an assumption in there that the governor would be against this. I don't think we should assume that. I think every question that you've come with, we've said, no, this is why this is more compassionate, because those people actually would qualify. And I think the governor, just as we do, sees the problem, right? We had a $2 billion increase from last biennium to this biennium just in this one line item. That equates to a 5% increase in general fund spending just on this one line item. We can't continue at that. So we need to look for solutions that will really preserve those dollars, which are important to the people that need them, but really preserve them for those people and make sure that people that are able-bodied are out in the workforce or at least looking for jobs. And I think that should be a common sense thing that this governor and frankly, almost all Minnesotans should agree with.
What about previous governors too? Governor Plenty through 2 terms fought this growth as well. Is this something you can really change? Is the, we've had now 2 terms of 2 governors that have seen this same trajectory.
We have to change this. We have to. We can't see that kind of continued growth again. $2 billion increase. If you care about roads and bridges, if you care about schools, if you care about almost anything else in the state budget, then you should be in favor of this bill. And the reason is, this is going to eat the state budget. This particular item is going to eat the state budget. And there will be less money available for schools, there will be less money available for roads and bridges and all the other things that all of the groups here at the Capitol think are important. And we know that the people that need these programs, and that's what this bill does, it protects these dollars for the people that really need those programs. And we know how important those things are. We think this is the best solution and a very common sense, compassionate solution to really solve problems that we've seen growing over time. So my hope is that we can come together in a bipartisan way and pass a reform that's going to help people that actually need these medical assistance dollars protected for them.
When you do a fiscal note on this, will you consider the possibility that increasing the working of this population will also increase the roles of Minnesota Care, which is a program that's also under a financial cloud right now with federal funding cuts and with the provider tax due to be sunsetted? What about the interconnection between this program and Minnesota Care?
We would hope that anyone growing in their employment skills will continue to see rising wages and move from MA through Minnesota Care onto employer coverage or independent coverage. So yes, it will have other impacts. This will have an impact in our revenue because we'll have more people who are taxpayers. And really our goal is to help everyone achieve their full potential. And we'll see a better Minnesota because of that.
Is there any way to estimate, will you seek a fiscal note on the cost of additional uncompensated care from people who are removed from MA roles?
If you want to.
So again, I want to stress that there are quite a few exemptions from this. I mean, the goal is to lift people out of poverty and get them into the job force, get them the job skills. Under the Dayton administration, I estimate this benefit program has grown by 350,000 individuals. And I question, there are many out there who do need this assistance, and we need to help those while also helping our able-bodied childless adults, lift them out of poverty into the workforce, get them the job training. The greatest thing that we could do for our families is to make sure their moms and dads have a great job.
vast majority of that growth in the program, though, should be just due to Medicaid expansion, correct? Not because of the Dayton administration's action, other than, of course, adopting Medicaid expansion.
We can't ignore that he was the one that did the early opt-in to Medicaid, right? It is because of that. But you can't tell me that the number of people that you know, the disabled or people that need these programs has tripled in the last 7 years. The number of people of Minnesotans, then if that was the case, our economy would be disastrous today. And we'd be talking about other things. But the reality is the signs are indicating that the economy is doing well. We have low unemployment rates. We shouldn't have almost tripled the number of people on medical assistance in the last 7 years. And the reality is that we have. And that has manifested itself in a $2 billion increase in one line item in one budget cycle. That's something that is wholly unsustainable. And if we ignore that, we are headed for a crisis in our state budget.
We've heard about Governor Pawlenty fighting this, and your sort of long-term concerns about this. Is it doable, or is this just a political, an election year effort to wave the flag as the Trump administration offers this waiver?
I absolutely believe it's doable. Again, I'm going to stress, last week we learned that there are more jobs available than job seekers. This is something I hear from my small business owners every day out of my district. So this is absolutely doable.
If I can, just for a moment, I think this bill, Representative Fenton and myself saw this earlier this year, and we both jumped on this one. This is one of those common sense bills that I think that people can really get behind. The arguments that you bring forward for, what if they have children at home, those types of things. We've made those exceptions. We're aiming at those people that should be participating in our economy and that aren't. We want to make sure we get them in. I come from Northwest Minnesota. We've got lots of manufacturing facilities up there. Job ads running all the time. We have buses from these manufacturing companies seeking out other cities to go and bring people back because we have such a lack of able-bodied people. So we're gearing this bill towards getting those people back into the workforce, contributing to our economy, getting on our tax rolls. This is a very good bill for that, and we're excited for doing that. So if you say, do we think it's going to happen? It's got some headwind, but it also has a lot of momentum behind it because this is something that we should be doing in Minnesota.
Thank you. Would it be your expectation that this would create then no increase in the uninsured rate in the state, or would there be a slight uptick in the uninsured rate with this bill?
Can I answer that? They told me I can never speak if you use initials or letters when you ask your question. I'm supposed to step aside, and I'm teasing. The reality is I remember when we passed Uninsured here in Minnesota. When I say we, it wasn't me. We were in the minority. Democrats did it. That one of the biggest reasons they wanted to do that was to reduce the number or reduce the amount of uncompensated care at our facilities. And the reality is today we have increased the number of insured, but somehow the rate of uncompensated care at our hospitals and care providers is still higher than it was before. Why? Not because people don't have insurance now, but because they can't afford to pay their deductibles. So, we have a problem that we need to answer just bigger than this bill and bigger than this problem. Everybody who's in the individual marketplace, and it was supposed to be 4 or 6 or 8 times more than it is now, basically have deductibles so high and premiums so high that they can't afford to pay their deductible when they go in for care. It's a separate issue from this bill, but we can't ignore that. So saying that we have more people insured today, I think is somewhat of a false statement in that the people who have that insurance, and I'm talking about $3,000 a month for your premium and a $13,000 a year deductible. I'm sorry, those people do not have insurance. That is not insurance. And that's what what MNsure and Obamacare has brought to those Minnesotans. And I think it's more than 100,000 Minnesotans that are affected by that. And that's not insurance. That's another problem separate from this bill that we also have to deal with.
That wasn't a response to my question.
No, and that's why Michelle's going to step in and give you her HHS answer.
The question is, do you anticipate an increase in Minnesota's uninsured rate if this bill becomes law, or would it be flat?
Our goal would be to have them go to work in a place where they could afford coverage. And again, if they're working, they get to stay on MA until they make enough that they move on to Minnesota Care, and then to continue working until they make enough that they have employer coverage or can buy coverage on their own. Our goal is to move people out of poverty, not to leave them trapped just because they're safer. We want Minnesotans to achieve their full potential so that our economy can grow and every Minnesotan can live the Minnesota dream. That's all.
Very good. Thank you so much.